This meeting is very, very important. And I want you to pay attention, particularly if you're in Nigeria now and you either have a job interview pending or you already have done an interview and you're rejected, or you have not even attended any interview. All of you are going to benefit from this meeting. Hi, my name is Abiodun Oluwatobi. Abiodun is the surname. Oluwatobi is the first name. I currently work as an emergency nurse with the NHS. I'm also an American Heart Association instructor for BLS and ACLS. Back home in Nigeria, I used to do trainings before I relocated to the UK. I do trainings for doctors and nurses on BLS and ACLS. I'm also the founder of NJO Nurses, and I'm pretty much sure NJO Nurses is not a strange name to many of you here, but I'm also a creative designer. I love designing. Even this slide, I've not designed the slide. I've also authored 3 ebooks. Let's jump into today's presentation. What we're going to be talking about is basically how you can prepare for an interview, having it in the mind that you want a successful outcome. So I want you to participate, because the more you participate, the better the chances of you retaining some of the information I'll be sharing. A lot of times, the challenge is that some people are not even getting shortlisted for interview. Hello? Some people are applying for jobs, thousands of jobs every day, but they are not getting shortlisted. Why? Your supporting statement is the game changer. I'm not going to talk about that in this presentation. We already did 2 hours video presentation on how to apply for a job in the UK. It's on our YouTube channel. Go and watch it and follow all the processes we give out for free there. And hopefully you get selected for interviews. Number 1, online job interview. For all of you here that are looking to migrate to the UK, all your job interviews is online. The number 1 thing you need to do first is you need to test run your computer. You need to be sure your computer is working perfectly well, because it's an online interview. You're obviously going to use either your computer or your tablet or your mobile phone. You need to do a test run. I'm clearly aware that some of the interviews for NHS is done on Microsoft Teams. So you need to be sure you have the app on your phone itself or on your laptop. I would recommend you use your laptop for the job interview. However, some of you might not have that luxury of getting a laptop. You can use your tablet or your mobile phone, but ensure you have your Microsoft Teams downloaded on the phone. But do a test run. Do a test run. Very, very important. Do a test run. Number 2 is to pick the perfect spot for lightning. And it's very, very much important that this is done before the interview, not during the process of the interview. During the process of them notifying you that you're getting selected for the interview, have it in mind that this is where I'm going to be using, either in the corner of your room where there's good internet data bandwidth, because I'm aware in Nigeria there's some position there is no good internet service there. So get a location that has good data service and also has good lighting, so that during the course of the interview, your face will be visible enough to those that are going to be interviewing you. Because it's very, very much important that they see your face, they see your expression, your facial expression, they see your dressing, they see your comportment during the course of the interview. All of these things are going to be judged. You understand? So get a perfect spot for lighting, where there's visible lighting, and you can assess the lighting when you do a mock-up, when you do a test run, or when you do a mock interview. You can see the lighting, you can see how visible it is, you can see how good the internet is at that location. You understand? Also, your background matter. The background where you're going to be sitting or positioning yourself also matter. You don't want the background to be busy. You want the background to be as calm as possible, to be as clean as possible, so that it doesn't distract those that are interviewing you. So ensure your background is clear. Just like my background, this is a perfect spot for me to have an online interview. So if I'm doing an online interview now, this spot is perfect. The background is good. There's enough visibility. The employers or those that are interviewing me can see my face clearly. And I'm using my laptop. You understand? So it's very, very much important that your background is not big. The next thing is to remove distraction or mute your phone. Basically, just mute your phone. And distraction is not only your phone. Sometimes you need to inform those around you that you are going to be having an online interview scheduled for so period, so that they don't bash into your room, or they don't knock, or they don't distract you during the course of the interview. So there is no point shying away from telling people that so period, I would like my personal space to be distraction free. Also, log in early. How early? 15 minutes is fine. You don't want to log in too early so you don't look desperate. So 15 minutes into your presentation, you should be ready, set, go. Have your computer on, connect to the link that I sent to you via Microsoft, or if it's Zoom, connect 15 minutes early so that you can get yourself prepared, so that they know you're in the waiting room and they know you're there as well. Also, very, very much important, sit up and dress professionally. You know, if you're guys, you want to dress business casual is fine, ladies, business casual. Also, while you're doing your presentation, try as much as possible to look into the eyes of the interviewers. So during your course of presentation, the screen will be there, either in your laptop or your phone, and there's a camera. For you to be able to look into the eyes of those that are interviewing you, you need to look into the camera. So this is exactly what I mean. Looking into the camera now, just like I'm doing, me looking into the camera of my laptop, and you can see that it's more like me looking directly into the eyes of everybody listening to me, basically. So that's what you want to do as well. During the course of your presentation, or sorry, during the course of your interview, look into the camera rather than looking on the screen. If you're looking at the screen, to the interviewer, it's as if you're looking somewhere else, more like looking somewhere else, not directly into the eyes. It's very, very important that you have that in the back of your mind. Your eyes on the camera always. While you're giving your responses, let your eyes be on the camera. Body language is important. They are going to be reading your body language because obviously they're going to be seeing you. And guys, I'm not going to lie, during the start of my presentation, you can technically gauge my body language. The way I'm describing, the way I'm gesticulating, you know, my verbal expression, the way I look, you can pretty much guess how vested I am about this presentation just from my body expression, just from my body language. And that is how you should actually present yourself in the interview. What I mean being conversational is let it flow. You know, once they ask you question, don't just give a one straight answer. Let it flow. Let it seem seamless to you. You understand? So all of these things would be, you know, gauged and scored during the course of your presentation. Also, what do you wear for an online interview? What do you wear? You know, I'm sure a lot of us have seen on Twitter or on other social media platforms where people actually dress the way I'm dressing with tie and they are wearing pajamas. Well, I wouldn't encourage you to do that for your interview. Dress as if you're actually going for a physical interview, down to your shoes. It's very, very much important. And I recommend business casual for your dressing. Dress business casual. There's a sample of business casual for ladies. So for guys, here is an interview business casual look. All right, let's talk about the common interview mistakes for nurses. See, number one, arriving late or arriving too early. Interview is for 8 a.m. 7 a.m. they are online. 7 a.m. they have joined the link. If your interview is for 8 a.m., arrive early. Good and nice, perfect. That's what everybody's going to advise. But don't arrive too early. Arriving too early is a sign of desperation, you know, and they can mistakenly admit you at the wrong time for your interview, and that can just, you know, throw you off balance. Imagine your interview is by 8 and they mistakenly admit you for 7 o'clock. You know, having programmed yourself that the interview is for 8, but you have logged in early, you have joined the link early, somebody probably mistakenly admitted you, and they say, oh, sorry, your interview is for 8. Is it for 8? It's not for 8. And all of those things can just throw you off balance. So you don't want to go too early. 15 minutes to your interview, log in, perfect timing. Don't go too early and don't go late. Another mistake is not having questions. Like I said, start practicalizing all of these tips that I'm sharing. by now, you should have loads of questions that you're going to be asking me after this presentation. And this is a typical example of why you're here. When you are going for, not even only job interview, when you're going for, meetings, conferences, you should contribute. Let them know you came. Let them know you are there. And how do they know? Is by asking questions, by contributing. When you go for an interview and you are not asking questions, that is an off sign that you are not even ready. So while you are going for the job interview, have a list of questions you are going to be asking the employers or those that are interviewing you. So the next point is follow up. Following up on a job interview is not only after the interview, but it starts before the interview. And what do I mean? When you go for your application process and you eventually get invited by an organization, you start your follow-up immediately you get the invitation. Follow up to know who are those that are going to be interviewing you. Is it the CEO? Is it your line manager that's doing the interview? And if you have the direct contact to interestingly, jobs on NHS usually leave contacts, mostly those that are going to be in the interview panel. So that's an avenue for you to actually even ask further questions before the interview. You're not going to be asking, you can't go and ask the person and say, what question will you ask me for the interview so that I'll prepare myself? No. You want to show that you are interested in the position. So you ask questions about that job role. Also, not researching the interviewer or the employer. You research those that are interviewing you so that you know their qualities, their caliber. You want to know who are those that are going to be asking me questions. That can give you much insight into the type of questions they're going to be asking you. You also want to research about the employer. Is this organization an organization I want to even work with? Is their location suitable for you? So don't even waste your energy of going for some interview. Rather, invest your time in researching about the employer to be sure that if I invest my time and energy in going for this interview and I get selected, I'm going for the job, not doing the opposite. And then investing your time, going for the interview, getting selected, and at the end of the day, you are not going for the job. It's a waste of time. It's a waste of time for the employer. It's a waste of your own precious time as well. Sharing too much information. Once they ask you a question, do not go around the bush and start jambulating. Always ask for feedback. Very, very much important, particularly after the interview process, irrespective of the outcome. And always prepare like a mock question for your interview. Whether you like it or not, the clues are there. When you apply for a job and you get selected for an interview, the likely questions for that job role will be in the job description. So you should have like a mock question or likely questions that is going to be asked during the course of the interview. And then prepare an answer for those likely questions. Even if you're not asked those likely questions, they might ask something similar. And because you have actually prepared some responses for similar questions, you will be able to give suitable responses. The mistake that many of you make is that you do not have any response to any question that is going to be asked. So you are going for an interview probably for the job role of an emergency nurse, and you don't even have a clue of the type of questions that is going to be asked. So whatever job role you are going for, look at the job description, and then you can mock up an interview question for it. NHS or UK job recruitment, the salary is always there. When you apply for the job, they will put the salary there. So don't come and during the course of the interview, they say, do you have any questions? They say, how much are you paying me? Forget that. The most important thing for NHS interview is your patient interest. That's the best way I'm going to summarize it. Answering interview questions. Number one, competency-based question. Most of your interview would have all these 3 types of questions. Take it or leave it. They're going to be asking you competency-based questions, scenario-based questions, open questions. And I'm going to talk about it. Number one, competency-based questions. These are questions that are designed to make you give stories to your interviewers. They want to gauge your competency. Is this nurse competent? We want to recruit somebody as an home care nurse. Is she competent enough to be a home care nurse? They are going to ask you competency-based questions. Example, how do you pacify an aggressive patient? They want to know how competent are you to handle that scenario. If you are exposed to a patient that is aggressive, how do you handle it? How do you handle pressure at work? As a nurse, are you competent? That is what they're asking. Are you competent enough to handle pressure at work? If there are lots of competency-based questions online, you can do your research. I'm just telling you that these are the types of questions that are going to be asking you. How do you respond to competency-based questions? You are going to use what they call the STAR technique. The STAR technique is simple, the situation. So they are putting you in a situation to say, how do you handle an aggressive client? You give that's the scenario, that's the situation now. Then the task is handling the patient. S is for the situation, T is for the task, A is for the action. Explaining what you are going to do, explaining your competence. They are going to measure, is this nurse doing the right thing? Is this nurse competent enough to handle that scenario? And what is the outcome of that action you have done? So that is the best techniques to answer a competency-based question. You give them the situation, the task, what is your job ahead, pacifying an aggressive patient. What action are you going to do to pacify? You want to pet the patient, you want to ask the patient why are they aggressive. You want to look at the environment to see, assess, do your investigation and all those things. And at the end of the day, when you do all of those things, what was the outcome? Was this patient pacified? Was this colleague of yours cooperative? So use the STAR technique. Scenario-based questions are, something we're all familiar with. Scenario. They are going to throw you in a scenario type of question or scenario type of event, and say, how are you going to handle that chaos? How are you going to handle that situation? And most scenario-based situations are situations that are not normal, situations that would require your thinking process. And that is where your nursing process kicks in. Your nursing process kicking in scenario-based question. Three techniques for answering scenario-based question. Number one, your nursing process. If your nursing process would not kick in, ABC, airway, breathing, circulation. If airway, breathing, circulation is not kicking in, you want to go to compression, airway, breathing. But let's even leave those techniques alone. The most important thing is your nursing process. For you to answer a scenario-based question, always think of your nursing process. What is nursing process? Assessment first.
Assessment.
Analyzing your data and information, and then you're planning, and then you are implementing, and then you are evaluating. Let me give you an example. What will you do when your patients refuse treatment? Number one, you want to assess what treatment is this patient refusing in the first place. Don't just jump. Patient refuse treatment. What will I do? I will report to my manager. That should not be your first question. You follow nursing process. Remember, like I said, this is a scenario-based type of question. If it's competency-based question, there are strategies to answer that. That's STAR. But scenario-based question, you're using nursing process. The first thing you want to do in any scenario that they throw you in, chaotic scenario, what will you do? Nostalgia, you are in this, no scenario, any scenario that they are in the question, assessment. Let me assess this situation first. Your assessment might be vital science. Your assessment might be to look at the environment. Your assessment might be to actually make further inquiries by asking questions. So assessment, and then you do what you plan. You plan your course of action. What are you going to do? okay, based on my assessment, this is what I'm going to do. Based on the assessment that my patient has refused the treatment for carrying out, for instance, wound dressing, this is what I'm going to do. This is my plan of action. My plan of action is to, try and pacify the patient or counsel the patient, or try and educate the patient. That's the plan. Patient has refused wound care. I will educate the patient on the importance of wound care. Oh, the patient has refused medication. I'm going to educate the patient on the importance of the medication. I'm going to, in your assessment first, is to carry out an assessment. Maybe the question is, if your patient refused medication, you do an assessment. Assessment might be asking the patient, oh, why are you refusing the medication? Is there any concern you have about this particular medication? You are carrying out assessment. Then you move to planning. What are you going to do? You now move to implementation by carrying out that plan, because you can't plan and leave the implementation for your colleague or leave the implementation for somebody else. You carry out, in this interview, you carry out the plan and you implement the plan. After you implement, you evaluate. Very, very much important. You evaluate. And after your evaluation, it doesn't stop there. You document. In this UK, you either do your documentation online or you do your paper documentation. So you document, very, very much important. And there's a word that is common here in the UK, you escalate. In the UK, they do not believe that you can handle scenario on your own. So it's in Nigeria that as a nurse, you are the manager, you are the doctor, you are the receptionist, you are the cleaner, you are the everything. You take the responsibility, you handle it. But in the UK here, they believe in teamwork. So if you are given a scenario-based question, you want to assess, you want to plan, you want to implement, you want to evaluate, and most importantly, you want to document that. And this is what I've done. No? Let everybody be my witness. I've documented it and escalate to your colleague. Most cases, escalate to the senior person on ground. And guys, if you throw me any question that is scenario-based question, this is the format that I'll use to answer the question. And you will not say I am wrong. You can say, okay, maybe I missed one or two things, but you can never say I gave the wrong response. Because in no setting will you give a nurse any form of scenario and the nurse does assessment first, carry out a plan or schedule a plan, implement the plan, evaluate the plan, document what he or she has done, and escalate to the appropriate personnel, and you say the person is wrong in a scenario-based type of question, nowhere. Quote me on this. So this is the best format for you to answer scenario-based questions. What the interview has are looking for when they ask you scenario-based questions, do you even use common sense? Do you have a good clinical judgment? Do you have what they call patient safety and well-being? Those are the things they want to get. They are not interested in you. They are interested in your competency. They're interested in your clinical judgment. Are you making the right judgment? Because as a nurse, when you are practicing, it involves clinical judgment. It involves critical thinking, carrying out some tasks and setting those tasks in order of priority. So assessment first, you take action, you document, you inform your line manager, or you inform the doctor in some scenarios. So communicate the things you have done, inform your line manager, inform the doctor, escalate where necessary. Also, in some scenarios, you need to follow the hospital guideline. That's the trick. There are some scenarios that they are going to give you. Then you can't make decision. Follow the hospital policy. Follow the hospital policy. The way nursing practice is here in the UK is different from the way it is in Nigeria. So as a nurse that is attending a UK nurse interview, you need to bring yourself to the level of a UK nurse. You need to sound like a UK nurse. You need to sell yourself like, I am a Nigerian nurse, but I can fit into this setting. They are not going to employ you because you're a Nigerian nurse or you have Nigerian skills. No, they want to know that, are you competent enough to work in a UK setting environment. That's what they're measuring. They don't care about your Nigerian mentality. Don't put Nigerian mentality in your response. Give them the response they want as a nurse. Don't be sentimental. Don't think that it's in Nigeria that we are sentimental. Yeah, they follow the hospital policy. They assess patient first. They carry out a plan. They implement. They evaluate. They document. They escalate. They follow the protocol. So if they ask you a scenario-based question and you're not following all of these things, or you're not even getting close, and you are following the Nigerian mentality, you are going to be going the Nigerian way. You can't. They are not going to select you. Hearing you be like, this person can fit into this setting. Bring this. I want this. And how do you give those responses? Follow their standard. Sometimes when you're going for some interview, when you're preparing for the interview, go and understand that job role very well. The clue is there. The clue for the responses are there, because they are going to be asking you scenarios that will be in that setting. So open questions are another type of question that are going to be asking you. Most times, these open questions are what to be asked before they start asking you scenario and competency. Tell us about yourself. Why did you apply for this job? Why did you even choose this NHS? What made you become a nurse? Why did you become a nurse? Why did you want to come to the UK? What made you decide to relocate? Why did you become this? Why did you want to come and work in cardiac? Why do you want to work in care home instead of NHS? Why? What? Why? They want to know your values. They want to know your competencies. They want to know why you are different from others. See, everybody that is being called for an interview have the same clinical qualifications for that role. All of you can work in that role, but they just want to know the most passionate person among you. Who is this nurse that stands out among all these other nurses? Why do you want to come to this NHS? Sell it to them. Sell the NHS to them. Sell yourself. Say, I'm the best out of the rest. I'm the best out of it. And it has to be in your responses. By selling your clinical skills for that role, saying things that even you, if you are the manager and you are hearing those things, be like, I want this in my team. I want this nurse. So you are applying for a cardiac role, a cardiac nurse, and you are mentioning things like ECG. You are mentioning things like cardiac monitor, myocardial infarction, managing hypertension. Those are the things you are saying. A manager will just be like, this come over. But you want to work in the care home and you say you don't have passion for elderly patients. Your interest is pediatric nursing. Care home is all about geriatric patients, dementia, confused patients, patients with diabetes, hypertension, pressure sore, and those are not the areas that are interesting you. Your own area. And they say, why do you become a nurse? You say, because I like babies. And you're applying for care home. Hello. Even if all your other responses are good, I won't take you because your interest is the peds. I know that immediately you come and join us, after 3 months, you start complaining and you start finding a way to leave. It doesn't benefit us. But somebody say, why do you apply for this care home? And you start saying, I like being a manager because working in the care home, you'll be working as a manager. I love leadership. I want to expand my leadership role. My interest is geriatric nursing, specifically dementia. I did a lot of research when I was in school in dementia patients. I want to see elderly people living a quality lifestyle. Those are the things that I'm like, yes, this person should come to our NHS trust. This person should come to our care home because you are doing what you are selling your experience, selling your skill, and why you should be in that role, why you are the best fit for that role. Action word, guys, action word. There are some job roles that if you do not say some things, they will not pick you. If you like, do your research, do everything. If you do not say some action words, they will not pick you. Emergency, you are not mentioning something like CPR, cardiac, assessment, they will not pick you. You are doing pediatrics and you are not mentioning baby. You are not saying, you are not giving some pediatric words, forget it. So go and learn those action words. And those action words will be in the job descriptions. If you are called for an interview, go and check the action words in the job descriptions. Ensure you mention those things when you are giving responses to your answers in the interview. You are going to get selected and you're going to be having successful outcome. Ethical principles. What are the autonomy? Meaning patients making their own decision. Justice, meaning you're going to be giving everybody equal care. Fidelity, remember, veracity, obligation to tell the truth, non-maleficent, beneficent, all of those things should be resonating in some of your responses. Job description, very, very important. Sorry, I misspelled this job description here. I was just preparing the slides. I didn't really do the double check for the spelling. And I already said this earlier, so I'm pretty sure you understand. But I mean here, job description. For any job you are going for the interview, study the job description like all the clue is there in the job description. You know, study it and you're going to be having a successful interview. Then managing your interview nerves. I want this managing interview nerves to be very, very much interactive. So from the house, I want you to give me tips on how you can manage anxiety during your interview. All right, so let's look at sample questions for care home. I deliberately choose for care home and not for NHS. For care home, sample questions can look like, why did you choose to work in the care home? You know, they are most likely going to ask you that, why not NHS? Why did you choose care home? So for those of you that are going to care home, have a response for that. You can say you're choosing care home because you want a closer patient interaction. You want to explore your leadership skills. Your interest is in geriatric care, or your interest is in managing dementia or diabetic patients. You know, they're going to ask you, how would you cope with stress? And I think this is also similar to NHS. They're going to ask you something related about stress. And it's not a coincidence. It's a deliberate question because you're going to be stressed. You're going to be stressed psychologically. So they want to know how you're going to cope with the stress. You know, and you want to tell them that you first of all would acknowledge the stress. You don't shy away from the stress. Everybody feel the stress. They want to just know how you are managing it. So don't tell them that you know they get stressed. So walking is your calling. You don't feel stress. No, you want to tell them that you acknowledge the stress, but you are going to handle the stress this way. You know, prioritizing your work, ensuring that you take your break during your break hours. You ensure you prioritize your work. You ensure you delegate where necessary. You know, so those are the things you're going to give. They're going to ask you that, how do you manage? What are the management qualities that you have? Because care home, you are going to be looking after like 30 and upwards patients as the only nurse. So that is going to test your management skills. You're going to manage patients, you manage your subordinates, you manage your colleagues, you also manage your orgas. You manage your orgas, your colleagues, and the subordinate and the patient. So your management skills must be sharp. So they want to know if you have that management skills. How would you manage end-of-life patients? Yes, most care homes usually have end-of-life patients. End-of-life patients are patients that are about to die. They're about to die, you know. They are known that they are going to die soon, but they're just giving them palliative care, pain care. Just you know that definition of nursing that says, and we're going to assist you to die a comfortable and peaceful death, you know. So they want to know if you have that capacity as a nurse to manage end-of-life patients. Type of abuse and what you will do. Most adults here in the UK experience abuse in one form or the other, either financial abuse. So you want to do a lot of reading on abuse and how you're going to escalate any case of suspected abuse. Pressure sore, you want to know types of pressure sore, how you manage pressure sore. Dementia, diabetics fall, how do you manage a patient when they have dementia or when they have diabetic emergencies, or when they are confused because of their dementia, or when they fall. Most adults in the UK are susceptible to falls. So see, anybody that is going for a care home job interview, you most likely have an idea of the questions they are going to ask you. So if you are going for that interview, in fact, to you, you should be confident enough of getting the job, because you are going to ask yourself, like, what's the question I want to ask me that I will not give response, that I don't know the response? Because you already have like mock questions and you have a prepared answer for that job or for that question. This scenario or this sample question, you can modify yours for the role you are going for. You can modify it for NHS. Just look at the job description and come up with similar or scenario questions and answer those questions. You can even send the question to your friend and say, you know what, let us set up a mock interview. Ask me all of these questions. Record the session and watch it. Watch the way you are responding. Trust me, that's the way you are going to behave when you go for these live interviews. The responses are going to be similar. Although there can be some few word changes, but they are going to be similar. So it is very, very much important that you have some mock sample questions in mind before you go for any interview. Before you go for any interview, if you don't take anything from this meeting today, is that before I will go for any interview, I must have a sample interview questions from the job description of that job, and I must have a response for that interview question. You understand? That's very, very much important. So we're coming closer to the end of the presentation. After the interview, two things will happen. It's either they reject you or they call you to take up the job. But as a nurse, you have a role to play. If you are successful, you now start another form of research from that point. Researching like the location, okay, what is the induction process? How am I going to migrate? What is the period of, me getting the job and me coming to start that role? What is the job role in details? You want to speak to your supervisor or the line manager. You want to engage them further. Don't just say I've won the interview and that's it and lay back. No, you engage them further so that you have a successful career with that organization. You have a successful landing. That's what I'm going to put, a successful landing. Because getting a job has its own palaver. But when you start the job, you start another palaver. It's as if palaver not even finish. Safe. The first palaver was IATS. You face that one now. You don't enter another interview palaver. As you are coming to the UK, your next palaver is all ski. That one's another ball game. And then you do your ski again. The palaver next is your job. Then you now start having job-related palavers. So palavers not the finish. But as a nurse, I think we're built in a way that, irrespective of the challenges, we always find our way out of it, and we always have positive outcomes. So if you have a successful job interview, that does not mean you need to now draw back and relax. Yeah, celebrate, be happy, but you now start another form of questioning and researching and making inquiries. If you get rejected, which is the opposite, it's a bit disappointing. I have gotten rejection letter for jobs interview. I know how it feels. But you don't stop there. You ask for feedback. It's very, very important. You know what feedback would do? Feedback would prevent you from making similar errors. And you don't want to be going for interviews upon interviews and making same mistakes. It's not ideal. So ensure you take feedback. Don't just say, I know even Kuku won the job before. If no be Nigeria way bad as it bad. Who they? No, that's not the point. The point is for you to now ask, I have failed though. But tell me waiting make una no even choose me. Where I make that mistake? Where? So that you avoid making that mistake and you learn from it. And you can even share your experience with your friend and say, oh, I didn't get selected because I said this or because I didn't mention this. Summary, sell yourself. Remember your dressing. Because a lot of people feel like online interview, the dressing is not important. No. Your job description is your manual. Chew it, and you're going to be successful if you understand the job description very well. Research your company or the NHS or the care home. Prepare answers to mock interview questions. Thank you all for the time and for your attention.